Hello everyone, my name is Emily Nozier, and I'm in the Master's in Science program at Towson University. My area of study is gerontology, and today I'm presenting to my class, which is a health communication class, an article review. The professor of this course is Dr. Brace, and this course, which is Health 502, is also offered as Health 402 to undergraduate students at Towson University. Let's get started. The article is entitled, "You Never Forget Your First Mistake, Nursing Socialization, Memorable Messages, and Communication About Medical Errors." The authors are Carrie M. Nolan and Heather J. Carmack from the Communication Studies programs at James Madison University. The background of this article revolves around a central theme, which is promoting the importance of communication in nursing. This will help to improve patient care and also reduce errors and mistakes. Nurses are in a position where they can minimize adverse health conditions by reducing these mistakes, which can help to improve the care for patients. Previous research has found that miscommunication is linked to death. 63% of deaths were due to harm related to medical errors, and 98,000 people a year die actually of medical errors, according to another study by Corrigan and Donaldson. So both JCAHO and these researchers have identified miscommunication as a problem related to death in nursing care. I want to provide this model which talks about the culture of the public health system. As you can see on this slide, what I would like you to know is that the nurses are part of the clinical care team. They work directly with the doctors and other healthcare providers. So they could be the watchdogs if there's any errors. They can help to prevent them, they can help to correct them, and improve overall patient care. This model proposed by Dr. Freed, I would propose may also consider the patient in addition to another component in this model. As you can see, patients are not one of the models. The research problem and objectives of the study include the nurses are very influential in preventing and correcting medical mistakes. However, they may not be adequately prepared to do so, so there is a lack of this in their training. Another issue is that not everyone will hear about errors. So although errors are being done, not everyone may hear about them in order to possibly correct them and prevent them in the future from happening. Another issue is the hierarchical system within a healthcare environment. Looking at the structure of the organization, you have the nurses, you have doctors, supervisors, healthcare administration, and there are different levels of power. So possibly nurses may feel confused or even feel threatened of retaliation if they do report an error, or if they don't feel comfortable talking about it and approaching the individuals who may have been at fault. So the hierarchy is one issue that needs to be addressed within a healthcare system to improve the easy flow and channel of healthcare communication. The study objectives of the study were nursing socialization, which includes how do nurses become integrated into the healthcare environment. How are they introduced and trained so they feel comfortable and they feel confident to be nurses? Another component is memorable messages. What are they being trained? What are they being told? What is being communicated to nurses during their training about reducing errors and preventing errors in the future? Another component of the study objectives is also the communication about the medical errors. So what types of errors are being done, and how are they being communicated that they're being done? What type of style is used to communicate, or what type of process is used to communicate when an error has been done? The research question was, what messages about communication and medical errors do nursing students learn during their clinical rotations? The participants and data collection revolved around 68 nursing students recruited from the 5-year-long nursing program, and this program was located in northeastern United States of America. 53.9% had at least 2 years of training in nursing. 47.6% were in their 5th year, and important to note, the most interested careers were the ICU and pediatrics specialties. The incentive for participating was a $5 gift card to the Starbucks competitor. This was a qualitative research design This study was approved by the IRB and also involved 45 to 90-minute interviews that were done one-on-one with the nurses. The responses were then audio taped and they were transcribed into over a 1,200-page document of transcribed words. The research design, like I alluded to earlier, was qualitative in nature. The interview contained 38 questions. The important thing to consider is the importance of communication within all these questions. So this would include what types of mistakes were the nurses making? What strategies did they use to handle these mistakes? What were the nurse and provider interactions like? These responses were analyzed via thematic comparative analysis to look at any repetition of words in the responses, were there any similar meanings in the answers, and what was the tone of producing those responses and the forcefulness in their voices. All of these were analyzed to determine any thematic ideas that were related in the responses. Some of the research findings of the types of nurse and student mistakes included mislabeling, so forgetting to label blood samples, patient names, entering the wrong vital signs, which was found in 18.3% of the nurses. Forgetting to document, administering the wrong medication, mismanagement of medication was found in 20.4% of the students. Negligence, which was the highest rate of 34.6%, showed that there were issues with, for example, elevating the bed and not putting the railing on. This would definitely connect to patient falls, which is one of the major issues in ER visits. Also, giving food to a patient that was ordered to be NPO. So all of these were errors. In addition to that, not noting patient complaints and pain were definitely signs of negligence that the nurses were committing. The results of the study included the most frequently reported types of nursing mistakes, as I alluded to earlier on the previous slide, were mislabeling, medication mismanagement, as well as negligence. Honest communication had involved not hiding a mistake and reporting. That was what the definition of honest communication was. And this was key in the strategy to improve patient care and safety and overall reduce the medical errors. It was also interesting that passive communication was found to be the most effective strategy and way of communicating error by nursing students. The conclusion of the study was that hiding mistakes and not reporting appears to no longer be part of the culture of patient safety. I thought this might have been somewhat of a contradiction to the previous results because they did find that negligence was of the highest rate. Although the study was very well written and it was excellent that the target population was that of nurses to really be able to assess what they thought, what their views are, and what they gained from any type of training, it was also important to note that there were still issues with health communication overall based on the responses. So still, there was an error in reporting being done. So not knowing who to talk to, what to say, and when and how were all issues that were revealed in the responses, as well as the target population may have been limited. Although the nurses play a pivotal role in healthcare, what about doctors? Are they being trained on medical errors? Do they know what to do? Are they being accountable for any medical errors? Also, the data collected, very interestingly, did not incorporate any gender differences or culture or personality traits. All of these areas may further affect communication and effective strategies to reduce errors. So this could be areas of possible research. And the final one was the communication style that the nurses recommended and was also recommended in the messages that they learned in their training was to be more passive. Does that mean that not being passive, so being assertive, is a problem? Could there be a balance? There may be situations where it's important to be more assertive. However, it's not necessarily what you say, but how you say it. So definitely working collaboratively and respectful and practicing more cultural competency could definitely involve a better communication style with knowing when to be passive, when to be assertive, or finding a good balance. Overall, I thoroughly enjoyed this assignment. It was a very interesting article, and I hope you all enjoyed it. I really appreciate your time. If you have any questions, definitely contact the professor, and here are the links and references, and I hope you enjoy this study. Goodbye.